Yes.
Ms. Pappenheim, I want to pick up the chronology in terms of the campaigning activities and the government's response now in June of 1998, so still waiting for the decision from the Secretary of State for Health. If we go to HSOC 00141188, we can see this is a letter. It's from you to Baroness Ramsay in the House of Lords. It's dated the 24th of June 1998, and you refer to various matters expressed by Baroness Ramsay in her capacity as, I think, Parliamentary Under Secretary of State for Health in the House of Lords. She'd been responding to the debate on behalf of the government, is that right? And responding to the matters raised by Lord Morris and others. And you pick up in this letter on a number of her observations and express concern or doubt about them. I'm not going to ask you about the detail of that because we have the letter. But if we go to the third page, we pick it up in the second paragraph. You say this: finally, I return to the core of our argument, which rests on the government's moral responsibility to recompense the haemophilia community for the harm suffered through their NHS treatment. There can be few other communities which have suffered so devastating a blow, and you go on to provide more details and information in relation to that. And then if we go down to the fourth paragraph on that page, it is a moral argument advanced on grounds of equity and social justice. None of the statements made in the Lords on June the 5th offered adequate justification for the government to ignore our appeal. So is it right to understand from this, and indeed from references elsewhere in the documentation, that the forefront of the Society's argument by this time was not to make out a case of, or try and make out a case of legal liability, but to articulate a case of moral responsibility?
Very much so, and I think this letter and everything else that we wrote and said at the time was focused on the moral argument, and it is very clearly set out there. Here is a patient group that has suffered what's referred to as one of the greatest treatment disasters in the history of the NHS, and we are arguing very clearly, as the letter shows, the moral case for addressing that, and obviously addressing the concern that the delay by government in responding is not acceptable given the degree of harm. So without going into the issues around negligence, maybe that will come up later, but at this point in time, and bear in mind that the Haemophilia Society is a small charity representing a very small number of individuals in the total population, our argument and the thrust of the campaign at the time was on applying that moral argument and gaining, we hoped, public support through media publicity, political support through the moral argument. And so it was about trying to apply that pressure on the government to do the right thing, as it says here, on grounds of equity and social justice. So yes, that is, the letter states clearly that moral case, the moral argument that we were using.
And we can see, if we look just below your name, that the letter, you've copied it to Tony Blair, to Baroness J, Minister of State for Health, and to the Secretary of State for Health, Frank Dobson. And then if we can pick up on that in HSOC 0009-365, please, Shomik. So this is dated the 20th of July 1998. It's Haemophilia Society Day of Action for Hepatitis C victims. People with haemophilia have today held a day of parliamentary action to urge the government to respond to the plight of those infected with the potentially deadly hepatitis C virus through contaminated blood products used in their NHS treatment. And then we can see reference to presentation to the Prime Minister of a petition, and further information about the delegation to number 10 in the next paragraph, that the mass lobby by people with haemophilia to the Commons, a question posed during Prime Minister's question time. And then you're recorded as saying this: it's a scandal that seriously ill patients suffering the combined impact of a lifelong disabling condition and the hepatitis C virus are still waiting for justice from the government. We're calling on Prime Minister Tony Blair to end the injustice now and accept that the government has a moral responsibility to provide financial recompense to people with haemophilia infected with hepatitis C through their NHS treatment, in the same way as been done for those infected with HIV in exactly the same circumstances. And then the next paragraph refers to the fact that the Haemophilia Society and Manor House Group met with the Secretary of State for Health previous September, and you're recorded as saying, at that meeting, Mr Dobson promised a speedy response. 10 months later, people with haemophilia are still waiting while more suffer and die. The delay is unacceptable. Is this day of action appears in part to be trying to bring the Prime Minister into the process, calling on the Prime Minister to end the injustice and accept the moral responsibility, question raised during Prime Minister's question time, and so on. Did that reflect a deliberate decision, a conscious decision by the Society to try and ensure that this was considered not just by the Secretary of State for Health, but by the Prime Minister and the Cabinet as a whole?
Absolutely, yes, because exactly as my words state right then at the time, I would say the same thing today. It is a scandal. It was a scandal then, and we wanted to bring this scandal and the case for justice and the impact of this terrible medical disaster, we wanted to bring it to the highest attention possible politically, and there is no higher than the Prime Minister. So absolutely our intention was to take this to the highest level. At the time, as I've already stated, the Haemophilia Society and our members, who are growing sicker by the day, were still waiting, 10 months of waiting. As I'd already mentioned in an earlier response, no indication had been given to us from the government or civil servants as to why this delay was going on. So we wanted to bring it to the highest possible attention to make sure, as we did, that it was brought up at Prime Minister's question time, so that there would be then on the record at PM's question time this issue, so that it was out there, and it was very much our intention to draw the maximum possible attention, to apply as much political pressure as we possibly could, and obviously as well as the activity within Parliament itself to ensure that we had media coverage as well. So yes, it was very much a part of the campaign to bring the issues to the Prime Minister, as you can see that we did.
We'll look at the terms of Mr Dobson's eventual response in a few minutes, but in the 6 years or so that you were at the Haemophilia Society as its chief executive, did the government ever engage with or accept the moral responsibility case that had been advanced?
I think it's quite difficult to say that. I mean, as to what the government was thinking within its own processes, I cannot comment on that. I guess I can only say that the facts speak for themselves, in that it had taken us so long. The campaign, as we'd already spoken about, had been running since 1995. We had to continue campaigning incessantly throughout my entire time with the Society. And it was only and I'm sure you will at some point come on to the difference between the response in the Scottish government and contrast that clearly with the response at Westminster, the UK government. But it was only towards the later stage of my tenure that there was any form of response from the government to our appeal. So it was a campaign that we have to keep running. And I think, as I said earlier, their actions, the government must be judged by their actions. And the response was long delayed.
If we just, so again, before we look at the response from Frank Dobson, if we just look at one further meeting, ministerial meeting that took place, HSAC 40306. Now, this is a few days or a week or so before the day of action that we were just looking at. But this is a meeting with Baroness J, 15th of July 1998. She was the junior health minister. It was a meeting organised by an all-party group of supporting MPs, and you attended as an observer. You say, in general, it was a very positive meeting, so this is the third paragraph, which helped tease out what the sticking points are for government and how we can push forward our case. Baroness J was very well briefed on the issues. And then you record that she made two central points, and it's really the first I want to ask you about. Why should people with haemophilia with hepatitis C infection be treated differently from others who've received HCV infection through their NHS treatment, i.e. via blood transfusions or tissue transplant? She indicated that it would be hard for government to provide financial assistance for our group and not for the others who are also HCV infected through NHS treatment. She also alluded to the long list of other patient groups with problems resulting from NHS treatment, e.g. those treated with corticosteroids, those unhappy with their treatment for breast cancer. Now, you then go on to record the position that was put forward about people with haemophilia being a distinct case, and the precedent already set in terms of provision for those with HIV infection. But then you comment, clearly government is very concerned about opening the way to further claims if they provide financial assistance to people with haemophilia who are HCV infected. However, as was said at the meeting, that should not be a reason for avoiding their moral responsibility to people with haemophilia and HCV. So is it right to understand from this account, your account of the meeting, that you took from that meeting that one of the government's concerns was if it provided financial assistance in response to the Society's campaign, it might have to provide financial assistance, which it didn't want to do, to those infected with hepatitis C through blood transfusion?
I think the best evidence of what was said and happened at that particular date is what is written there. So from my memory and recollection, I wouldn't be able to add anything more to what's written. I've no reason to doubt that what I wrote then in the moment is an accurate record of what we understood at the time. So I don't think I have anything more to add from memory. I would just refer to what was written there.
And then if we come to the decision that was then finally provided to the Society by the Secretary of State for Health, Seamus, it's DHSC 001654. 28th of July 1998. It's addressed to Mr. Hodgson, the chair of the Haemophilia Society. As you know, we've been giving lengthy and very careful consideration to the Haemophilia Society's proposal that haemophiliacs who've been infected with hepatitis C through NHS treatment should receive special payments. The government has proceeded on the basis that compensation or other financial help to particular patients or groups of patients is only paid out where the NHS or individuals working in it have been at fault. The needs of people whose condition results from inadvertent harm is met from benefits available to the population in general. I am sorry to have to tell you that after considering all aspects of this matter, we've decided that we should not make an exception to the general rule in the case of haemophiliacs infected with hepatitis C. and then the following paragraph rejects the Society's view of that haemophiliacs could be treated as a special case. And then if we go down the page, in response to the argument that those with hepatitis C are in a similar position to those infected with HIV, Mr. Dobson says, we take the view that the circumstances of the people infected with HIV were different. The stigma surrounding HIV at the time the decision was taken, the fact that it was generally considered a sexually transmitted disease, and that haemophiliacs could have inadvertently infected their partners were all important considerations which do not apply to hepatitis C. And then if we go over the page, there's reference in the first paragraph to a possible project in terms of the provision of information and advice for young people. And then in the last paragraph, Mr. Dobson says, I realise that although this commitment will be welcome to you, the one in the previous paragraph, as was my earlier decision to make recombinant factor VIII available to children under 16 and to new patients. This response on special payments is not what your society was looking for. This has been a difficult decision to make, and we've looked at a number of alternative approaches, but I'm sorry to say that none of them seemed the right thing to do. Two questions I wanted to explore with you, Ms. Pappenheim. The first is, if we look at that last sentence, we've looked at a number of alternative approaches. As far as you can recall, did the Department of Health ever discuss with you the alternative approaches referred to here and ask for your input on them, or give you any understanding of what those alternative approaches might be?
No. To my recollection, they didn't. And I think if they had done, then there might be some written documentation and evidence to be found in the various reports of the Society, of minutes at the time. So I'm not aware of any alternative approaches having been discussed with us. And with hindsight, if such approaches were discussed with us, I would think that would be quite a significant thing. There would have been definitely some written evidence of such discussions that could be found in the Society, but to the best of my recollection, they did not share with us what those alternative approaches might have been. And I think I can say fairly certainly that they did not share with us what they might have been or ask our view on them. So that's about as much as I can add to that.
The second issue I wanted to ask you about emerging from this decision really is to, if you can help us understand what the Society's reaction and your reaction as its chief executive was to this decision by the Secretary of State for Health on the campaign that you had been putting forward.
It was a huge setback and extremely disappointing. So at the time, I would say there would be anger, disappointment, and probably a sense of incomprehension as to why the government would have made this decision. So it was a huge disappointment and a considerable setback for the campaign. Obviously, as the Society, the Haemophilia Society, and I as its chief executive, we were not accepting that was an end of the campaign. So we saw it as a considerable setback. We saw it as a moment to think that we'd already been campaigning for years, and that we'd campaigned very hard, very systematically. So it was a time to pause for thought about perhaps we need to think about how we continue this campaign differently, reassess the way that we've been conducting the campaign. But we definitely did not take no for an answer, and we intended to continue to fight on. And so you will see that in other documentation, other evidence I provided, that this was not accepted as an end to our campaign.
And before we look at the direction that the campaign or campaigning activity then took, if we just go to HSOC 00013933, this is a memo which you sent on the 30th of July 1998 to trustees, informing them of the decision and providing them with a copy of Mr. Dobson's letter and the chair's response, which I won't take time looking at, but we have that. And then you say this is an extremely disappointing decision, it goes without saying. Having discussed it with Department of Health officials yesterday, I've been told that the issues were taken to full cabinet and that number 10 was involved in the decision. Hence, in terms of taking our case to the highest level, we could have done no more. So is it right to understand from this that the information provided to you was that this had been taken not just at the department level, but with the input of the Prime Minister and the input of the Cabinet?
Yes, I haven't got the detailed recollection of the time, but I'm sure that what I wrote there, which is, written in real time in the moment, is accurate. And obviously, as I wrote at the time, we had taken our case to the highest level politically, and on that at least, perhaps we could. I don't think to congratulate ourselves would be at all the right thing to say, but we had been successful in, we believed, taking our issues to the highest level, but utterly disappointed with the decision. And so, of course, as it then says, we had to really take stock and think, we are not giving up this campaign in any shape or form, but we are going to have to think about how we go forward from here after such a disappointing refusal.
And so if we then pick matters up in the autumn of 1998, I'm not going to go to all the documentation, but you prepared a paper for a Board of Trustees meeting in September of 1998, setting out strengths and weaknesses and a range of different options in terms of the future direction of the Hepatitis C campaign. What I want to do is just then pick up what the Society's decision was as to how to go forward. And if we look at HSOC 00143999, please, Shomik. So this is a document from October of 1998, headed Hcv Campaign Update. There's a history of the campaign set out on the first page. If we go on to the next page, under the heading Future Action Plans, what we can see set out is the negative response from the Labour government to our appeal for financial assistance is a huge disappointment, but the Society and our supporters are not giving up the plans. Future action plans include parliamentary action, continue to put pressure on government through parliamentary questions and other means. International focus, draw on the examples of what happened in Canada and Ireland, where government has provided financial assistance for people with haemophilia infected with HCV. Public inquiry, the Haemophilia Society is calling for a full public inquiry into safety of the UK's blood service and how these infections took place. This information is crucial for public health, and we believe people with haemophilia and the general public deserve answers. And then we see the next three headings: improving services, providing services for those with HCV infection, tackling insurance and mortgage problems. Is it right to understand from this, and there are other documents we can look at if necessary, that what emerged in the autumn of 1998 in terms of the Society's campaign priorities was in part a decision to try and focus it now on a calling for a public inquiry, both as is said here, to get answers, so as an end in itself, but also as a means to an end, the hope that those answers would then provide the spur for financial support? Is that what the Society decided to do?
I think if you, and you may be going to do that, if you refer to the discussion document that I prepared for the trustees' review, you'll see that within that document there was a whole set of different opportunities and options for pursuing the campaign. As I said earlier, having had the rejection from the government, thinking about how we should take matters forward was absolutely central to the discussions taking place between myself and the trustees. So we had in the paper that I prepared, a whole range of options. Included in that was the public inquiry. As you correctly said, there were two reasons for the public inquiry. One is, as has been said over and over again, this was a huge treatment disaster in the history of the NHS, and from that regard could be seen as requiring a public inquiry, crucial for public health. So that was the rationale, but of course at the same time, a public inquiry would raise the profile and bring to light the issues that we were campaigning on. So I think it's hard to disentangle the two, but they go together.
And if we just look at that briefing paper, it's HSOC 0016864. You identify in the bottom half of the page strengths and weaknesses of the campaign. Strengths, powerful case, strong support, campaign expertise, government position weak. Over the page, weaknesses, lack of money, internal issues, and you refer there to lack of unity within the organisation, internal tensions and divisions. And then lack of legal muscle, the lack, you say, of a legal dimension, and you compare that to the HIV litigation and the pressure that applied, low public awareness of hepatitis C. And then we can see ideas for future action. You say, you ask whether there's more who could make of various arguments being used by the lawyers pursuing cases at the moment. And if we go to the top of the next page, you refer to drawing on lawyers' lines of argument, which could add a very different dimension to the moral case, then redefining the campaign's content, information content and messages, international links, drawing on what's happened in Canada and Ireland, and then public inquiry. We could make the case for a full public inquiry. The call for public inquiry / Royal Commission would give our supporting MPs a focus for action. In both Canada and Ireland, a public inquiry has led to compensation for people infected. And then you refer to various other matters, improving services, tackling hardship, used devolution, which I'll come back to. Over the page, influential support, so trying to recruit more peers and opinion leaders, and then raise the profile of hepatitis C. These are a range of avenues to follow. Were your, I mean, there's more documentation we can look at if need be, but broadly speaking, were the ideas that you were here putting forward accepted by the board, in particular the suggestion that the campaign would now seek a public inquiry?
Yes, I mean, there would have been debate and discussion, but and all of these different aspects and angles, I mean, they were all regarded as potentially worthy options, but as pointed out, there were always constraints, resourcing constraints on the organisation. But yes, I think broadly speaking, and then you will see that there was subsequently a reformulation of the objectives of the campaign, which probably will be seen in the next documents that are coming up.
Yes, we'll come on to that in a little while. I just want to then pick matters up at the end of 1998. So if we go to HSOC 00212335. So we can see this is a HCV campaign update now from December of 1998. The HCV campaign is gathering new momentum in Scotland, Wales and Northern Ireland with a devolution process going forward. In effect, once each of these does their own parliament or assembly, those bodies will have the power to determine health policy and could choose to set up their own financial assistance scheme separate from what might be decided in Westminster. So is it right to understand, and we'll look in a little more detail at some of the issues in relation to Scotland, but is it right to understand that there was a decision taken by the society to try and use the process and consequences of devolution to lobby in the devolved nations specifically, rather than concentrating all the efforts on Westminster?
Exactly so, yes.
And then if we look at the bottom of the page, we can see their call for public inquiry. The Society wrote to David Hinchcliffe, Chairman of the Health Select Committee, requesting that an inquiry be held on how thousands of people were infected with hepatitis C through treatment with contaminated blood products in the 1970s and 80s by the NHS. And then in the next paragraph, there's a comment by you. The government's response to our request for financial assistance for those infected was issued by Frank Dobson on the last day of the last parliamentary session, and there was no opportunity given for debate or questions. There's a dearth of information available on how the infection came to be spread so widely in the blood products used by the NHS. We would like the Health Select Committee to investigate this matter fully. Now, just again, two questions arising out of that. It would appear from this that the public inquiry that was being called for at this stage, December 1998, was focused on hepatitis C rather than a broader public inquiry looking also at HIV infection. Is that correct?
I think that is a little difficult to comment on now, so distant from the time, because although that is what is written there in that document, at the same time, we're talking about the whole impact of the contaminated blood products infection. So in any discussion that was taking place about the impact of infected blood, we would of course have been talking about HIV as well, but the words there, I see what they say. They mention hepatitis C and not HIV. But I do not believe that it was our intent, that it would have been our intent, that if there were to be an inquiry, it would have to look at the whole situation with contaminated blood, and it would be very difficult to somehow separate out the viruses from each other. But it is a little difficult to comment at such a distance of time on why that was written as it was.
We'll see if any of the later documents shed any light on it. And then just picking up on the second point, the call here is for an investigation by the Health Select Committee. Now that's something less than a full public inquiry. Why was the decision taken in the first instance at least to seek a Health Select Committee inquiry?
It was a pragmatic decision. I think it's probably very well known that a public inquiry is a huge and very costly exercise. And as has been said in my written evidence, persuading the government, because it would have to be the government to be persuaded to have that public inquiry, persuading the government to commit to that is no small undertaking. And it took many years after I'd already left the society for that to come about. So I think it was pragmatic, and also in recognition politically that the Health Select Committee is an influential select committee within Westminster, and that we are looking at a tactic, if you like, that it would be a very significant issue for the Health Select Committee to look into this matter. When the select committees do their work, they make reports and recommendations to government. So it would be regarded at the time by us in thinking about how we take forward the campaign pragmatically, that it would be a very big step forward to persuade the Health Select Committee to hold an inquiry of its own. And when the Select Committee makes its report, it would be to government, and there would be then an expectation that government would have to respond. So the two issues wouldn't be mutually exclusive. They could be incremental if we were successful in persuading the Health Select Committee to look into this and make report and recommendations to government. That might well have served as, if you like, a mechanism to then continue the pressure for a public inquiry. The Select Committee would be a step to perhaps the next level of being persuading government to embark on a public inquiry. But that call for a public inquiry, we recognised, was something very ambitious and not easy to achieve, and governments are not easily persuaded to embark on public inquiries, we believed.
If we move then forward to the autumn of the following year, 1999, and pick the campaigning activity up from the bulletin from the autumn of 99 at HSOC 00233027. We can see there the heading, Society calls for urgent action in Scotland. The Society has succeeded in its call for a meeting with Scottish ministers after new evidence revealed people with haemophilia in Scotland may have been exposed to hepatitis C through contaminated blood products for up to a year longer than those in the rest of the UK, and then references made to the different dates upon which heat-treated products that might eliminate the virus were introduced in Scotland from the rest of the UK. In responding to publicity surrounding the issue, Scottish Health Minister Susan Deacon has asked the Society to meet her to discuss our concerns. And then if we look towards the bottom of that column, it refers to you saying we've been campaigning for the last 5 years for a proper response from government to the infection of people with haemophilia, with hepatitis and other viruses. This new evidence that Scotland was behind the rest of the UK as inadequately treating blood products is extremely worrying. We believe it highlights the need for an urgent inquiry. Now, again, there are other documents we can look at if it would assist, but it would appear from this that it's relatively newly come to the attention of the Haemophilia Society that there was this differential position in Scotland. Is that right?
I believe so, yes. I mean, by memory, I can't add any more to this, but I believe so. That is right. And, you know, that was a very, very significant piece of information to come to light, that there could have been this time lag between England and Scotland, very significant, and particularly significant to bring that to the attention of the Scottish government.
And is it right to understand that a focus then of the Society's campaigning activities was now on Scotland and on trying to see whether things could be achieved through Scottish ministers that you'd been unable to achieve through Westminster?
Yes, that's correct. And we had very, very active and engaged membership in Scotland. I mean, you can see a couple of individuals, their photos are there. But the groups in Scotland heavily engaged and active. And we were very, very clear that there was an opportunity in Scotland due to devolution for our members to gain access, perhaps in a way that would be different from Westminster.
And then just to get an update as to what had happened in Westminster, if within this same document we go to page 10, please, Shomek. We can see there hepatitis update, campaign update number 10 involved. It's been a busy time for the Hcv campaign, not only with the recent blaze of publicity in Scotland, but with much behind the scenes activity at Westminster as well. including an approach to the Prime Minister by a number of senior Labour parliamentarians led by Lord Alf Morris and Roger Godsiff MP. Among the signatories to the letter sent to Tony Blair in May, which called for a public inquiry into the contaminated blood disaster, were Lord Robert Winston, Baroness Sirota, Frank Field and Norman Goodman. With an appeal coming from such senior and respected members of the Labour Party, it was a shock and disappointment when the Prime Minister refused the request for a meeting and rejected the call for a public inquiry. He stated, though I recognise that people with haemophilia and their families feel a sense of injustice, I am not convinced that a public inquiry would provide greater insight into the problem or pave the way for any further improvements in the safety controls which are now in place. So we don't have the precise dates here, but do we understand from this, and sorry, I should say if we go to the next paragraph, we know this happened in the first part of the year because it says not content to leave the matter there. Lord Morris wrote again in July to ask the Prime Minister to reconsider, or that the response was again negative. It's right to understand from this that the Society had, either through or with the assistance of the parliamentarians identified here, both requested the Prime Minister to meet with them and sought a public inquiry, and it was no to both.
Yeah, and just to highlight, it states here what they were calling for on our behalf, a public inquiry into the contaminated blood disaster. So that was, I don't have from memory or a copy of what they actually wrote, but the words here, they were calling for a public inquiry into the contaminated blood disaster and made that appeal directly to the Prime Minister.
Now, if we then, and again, we're still in the latter part of 1999 now, go to HSOC 0029689_029, please, Shomik. We looked at this document for a different purpose already this morning. It's the notes from the Trustee Board Away Day, 27th of November 1999. Again, can we go to the bottom of the page? I asked you previously about the organisation issues. If we now look at the section on campaigns, you pose these questions. Are we sure of the mandate to continue the Hcv campaign? Should there be different objectives in England, Scotland, Wales and Northern Ireland? The campaign is already being conducted differently in the countries of the UK. How long do we go on? What should we do about the co-infection HIV-HCV issue? Recombinant campaign, should we increase the level of activity to press for recombinant for all in England in light of the Garvacan survey? Now, again, we'll look later at how the Society proceeded in due course, but this was a document recording views expressed by members of the Trust Board, as I understand the document. Why were these questions being raised at this point in time?
Well, the purpose of this document was, and could we just for a moment look at the total document? Is
yes,
it possible
of course.
to come out of that section and go to the heading of the document? So it was very much planned, as it says, as an away day, with the format of being a meeting at which strategic issues are debated and discussed, not a decision-making board meeting. So it's quite the structure of this document really suggests the type of themes that might be brought forward for a strategic thinking day rather than a decision day. So there are points here that will have come up, I'm sure that they reflect questions and discussion topics that were around that day.
And if we go to the bottom of the page again, Shomik.
There we go, to those.
So is it right to understand this as indicating that those participating in the Trustee Board Away Day were questioning whether the Hcv campaign should continue, and if so, for how long, raising that as an issue to be looked at, but not reaching any definitive conclusion one way or another at this stage.
Correct. And, you know, this was very much the purpose of this day. It was to think, to address questions, to allow legitimate questions and debate to take place. And in fact, that is wholly what you would expect of a responsible trustee board, to really think in this way, to pose questions, and obviously from that, decisions at a later stage would have to be taken. But they seem entirely relevant questions that we would have been asking at the time, because ultimately the trustee board would have had to make some very difficult strategic decisions, not least about use of resources, and that question, how much resource do we commit and how long, would be a very valid one. So yes, it was a thinking day where people had the opportunity to raise questions, but not one at which it was expected that a decision would be taken.
Now, I think also in November 1999, you and the chair of the Haemophilia Society, Mr. Hodgson, met with Lord Hunt. And if we go to HSOC 302038, please, Shomik. We can see this is a letter dated the 24th of January 2000. It's from Lord Hunt in his capacity of Parliamentary Under Secretary of State. And it's addressed to Mr. Hodgson. Thank you for your letter the 23rd of November to the Prime Minister about the provision of compensation or other financial help to people with haemophilia infected with hepatitis C. He's asked me to reply as this is my responsibility, and of course I met with you and Karin Pappenheim on the 30th of November, and we discussed many of the issues raised in your letter. At our meeting, I made it clear that we have great sympathy for haemophiliacs who now have hepatitis C as a result of treatment. However, I also made it clear that our policy remains that compensation or other financial help is only given to people who've suffered harm in this way when the NHS is at fault, has been at fault. We do not believe that we should make an exception to that general rule in the case of people with haemophilia infected with hepatitis C. So again, just pausing there before we look at the next paragraph. Do you have any independent recollection of the meeting with Lord Hunt, Ms. Pappenheim?
I don't have a memory of what actually happened on the day. No, sorry.
Is it right to understand from this and the reference to the chair's letter and the reference to the meeting that the society was still trying to get the government in Westminster to consider the case for compensation or financial support?
Oh yes, absolutely, because as I've said earlier, from our point of view, the campaign was not stopping. We were continuing on, and we're not taking no as an answer. So that would be where we were coming from, as it were. But as you can see, the same arguments continue to be made by government as in the letter.
And then we can see the public inquiry was also discussed at the meeting, or the issue of a public inquiry, and Lord Hunt says, again, I repeated the conclusions of the Prime Minister and ministerial colleagues that we do not intend to pursue this. And then the letter continues, I think, in relation to matters relating to care and treatment that I don't need to ask you about. Apart from what we see set out here in that paragraph about public inquiry, which is really a refusal rather than a detailed response, did you ever have articulated to you, as far as you can recall, any kind of detailed reasoning as to why the government would not hold a public inquiry?
No. As we've looked at, what the written evidence of what their thinking is in the publications, the documents that we've just been looking at in this last session. So there isn't any specific reason that I can recall being given. So I can't really add anything from memory. I think we can only go by the documents, and perhaps the inquiry would have to look behind the scenes into government at the time, us to know, to find out actually what were their reasons for declining.
Yes, well, the inquiry certainly will be doing that. And then if we move then to the summer and autumn of 2000, it would appear that the Society was undertaking a strategic review of its campaigning activity. And so we can pick that up, first of all, at SCGV 0000172_061. It's August 2000. Dear friends, the Hepatitis Campaign, tell us your views. I'm writing to ask you to contribute your views to a strategic review of the Haemophilia Society's campaign on behalf of people with haemophilia who were infected with hepatitis C through contaminated blood products. Having fought this campaign for more than 6 years under both a Conservative and a Labour government, the trustee board of the Society is now undertaking a full review of the Hcv campaign, its aims and objectives, including an examination of what's been achieved so far and what the prospects may be for the future. And then we can see, if we look at the bottom of the page, below the bullet points, you say the context for the review is that the Society as a charity has limited resources. Staff time and money devoted to the Hcv campaign cannot be directed to meeting the increasing demand for information, advice and support services or campaigning on other issues such as recombinant. And then you say at the bottom, I'm aware this campaign arouses very strong feelings within the haemophilia community, particularly around the matter of financial assistance. And then if we go to the top of the next page, you say, please take part in this important consultation by letting us know your views via the enclosed questionnaire. We want to have full input from all sections of the haemophilia community and all interested parties to assist the trustees' discussion of the future of this campaign. And then if we just look at the circulation list, we can see members of the Haemophilia Society, and it's, I think, not difficult to understand why you would want to ask for the views of members of the Haemophilia Society. You also refer to seeking views from the chair of UK HCGO, chair of the Haemophilia Nurses Association. What was the thinking behind asking for their input into what the future direction should be of the Society's campaigning focus?
I believe that our thinking was this was genuinely a strategic review, and the thinking about a strategic review would be typically that in a strategic review, the views of quite a wide range of stakeholders might be sought. So it wouldn't be unusual at all in a strategic review to ask for input. And in my professional life, I've conducted a lot of strategic reviews, and it is quite a typical approach to consult a wide range of relevant stakeholders, and all of those listed there would be regarded as significant stakeholders. Different, of course, they're not a part of the membership of the Society, but their views as stakeholders in a strategic review would be of interest to the charity to know about. So that would explain that wider distribution, the wider inclusion of stakeholders in a strategic review.
If we then look at the outcome of the Society's decision-making, having conducted this consultation, if we go to HSOC 0016621, this is one of the Society's publication's C issues, September 2000, a quarterly newsletter for people affected by haemophilia and HCV. And if we go to the second page, we can see there HCV campaign review. It refers to the trustees and chief executive reviewing the hepatitis campaign. And then in the second paragraph, to a specially convened meeting on the 11th of September of the Society's trustees and chief executive, reviewed the history of the campaign, the political and press media aspects, the international and legal dimensions. This included a variety of presentations from experts. Also considered was the feedback from consultation with members carried out by the questionnaire survey in August, which showed broad support for the campaign for best treatment as well financial assistance, with no strong body of opinion in favour of a change of direction. And then there's reference to issues relating to hepatitis C treatment and research, and availability of interferon and ribavirin. And then if we go down in this article, it says, but to date, the attempt to gain financial assistance has not succeeded, nor has government been persuaded to hold a public inquiry, as has happened in Canada and Ireland. After long discussion, it was agreed to revise the aims of the Society's campaign as set out below. And then we can see 4 aims: to persuade government to provide financial assistance to meet the needs of all people with haemophilia and related bleeding disorders affected by HCV, to press for the best treatment and care for people with haemophilia and related bleeding disorders infected with HCV, to persuade government to hold a full public inquiry into contaminated blood products, to ensure recombinant is available to all throughout the UK regardless of age or viral status. Perhaps the most important change is that the revised aims, whilst including financial assistance, place more emphasis on improving treatment and care, and particularly on securing wider access to recombinant. The immediate effect of this will be to renew the Society's campaign for recombinant for adults, focusing on the unfairness of the treatment by postcode situation which persists across the UK. So, Ms. Pappenheim, is it right to understand that whilst financial assistance remained an aim of the Society's campaign, it was perhaps no longer going to be quite such a high priority in terms of the actual activities undertaken by the Society, and there would be more emphasis on the campaign for recombinant at this point?
I'm not sure that would be a completely accurate description of how it was at the time. I would say that it's quite difficult to kind of attach a weighting to these different aims and objectives. What I hope would become apparent from this evidence is that the Society was campaigning on all these different fronts during the same period of time, and that there was no let-up, there was no sense of lesser priority being attached to campaigning for financial assistance. But at the same time, for people with haemophilia, recombinant and getting access to recombinant for all patients, absolutely essential. So I think we were in the difficult position as the organisation, as has already been said, relatively small charity with limited resources. We had to try and do all of this, and I wouldn't entirely say that the recombinant took the place of campaigning for financial assistance. We had to do all of these things at once, which was quite challenging, and I think they were all important. But again, it's a diverse community, haemophilia, people with haemophilia. Some members might say, well, recombinant, go for that, that would be my top priority. Others might say, you should do nothing else but campaign for financial assistance. So we were trying to balance and meet the needs for advocacy of the whole community, and to try and address all of these issues in the same time. And obviously that was my tenure in role as CEO there. We were having to do all of these at the same time and more on the campaign front. If
we then pick up the last bulletin of 2000, the winter 2000 issue, at HSOC 00233036. We can see, if we go to the third page, your column in the bulletin, and we pick it up in the third paragraph. No account of this community's history could fail to include the tragedy of contaminated blood products, yet here another year has passed and still there's been no official public inquiry into this disaster. The long-awaited report of the investigation in Scotland, called by Scottish Health Minister Susan Deakin, was issued shortly before we went to press and has proved a sad disappointment. The report completely failed to examine the political decision-making process in the 70s and 80s and did not answer questions about whether cost considerations came before safety for the politicians and their advisors who were responsible for blood products policy in that era. And then you refer to press revelations about the BSE inquiry, cases against the National Blood Authority, and you say these findings are likely to renew the debate about past blood safety policy and provide more grounds for the public inquiry we have been seeking. So is it right to understand from this that trying to secure a public inquiry was still something that the Society wanted to do, albeit that other than the Scottish inquiry, the results of which you summarise here, the request for a public inquiry was falling on deaf ears?
It was falling on deaf ears, but I mean, obviously we were ever more convinced that a public inquiry was absolutely essential. I mean, I wouldn't change anything of what I wrote there at the time. There were more questions that were unanswered, more cause of concern that we were well aware of, as I wrote at the time. And the Scottish report clearly had disappointed the Society and our members because it hadn't answered these questions, which continue to be asked, and obviously it was unsatisfactory in every way. So we were even more motivated, if you like, to continue to press on. As it says, there's even more grounds for a public inquiry than there ever were.
And if we go to page 6, we can see a broader campaign update. We can see in the top of the page the aims that we looked at in the previous document. They're articulated, the aims of the Society's campaign. And then we can see under the heading Scottish Executive Report, there's a more detailed article about the Society's view of that exercise. If we look at the bottom of the page, you've referred to it as a very thin, incomplete piece of work which does not represent the full inquiry we were seeking. And no commitment to action in the form of financial recompense. And then if we go to the next page, we can see particular steps being taken in relation to recombinant, with the Society having written to Lord Hunt on the 22nd of September requesting an urgent meeting on recombinant, and their reference made to the risks of transmission of VCJD through blood. Is it right to understand that by this time recombinant was available for adults in Wales, Scotland and Northern Ireland, but unavailable in England for those over the age of 16?
My memory, I wouldn't wish to rely on my memory in answering.
If we look at the third paragraph, I think it says the Society pointed out the recent survey of recombinant provision carried out by Dr. Linda Garvican revealed considerable inequity in recombinant provision. It showed that NHS commissioners in Scotland, Wales and Northern Ireland have adopted a policy of recombinant for all, while in England health authorities are restricting recombinant largely to the under 16s. So is that one of the issues that was being raised by the Society with Lord Hunt?
Oh, absolutely. I mean, at the time when I was with the Society, we saw this inequity of provision. So it's another version of treatment by postcode that we were highlighting here. But yes, absolutely, that was the point that we wanted to make. That there was such a geographic variation, and that could not possibly be justified, given that these are all patients suffering from the same medical conditions at a time when clinicians had said categorically recombinant is the treatment of choice for those who have hemophilia. So this inequity, this patchwork of geographic variation was entirely unacceptable, and that was very much the point that we were pressing there.
Now, we heard from the evidence of Mr. Taylor yesterday, Simon Taylor, about concerns he had at this time about the Society's campaigning activities. If we look at HSOC 0029529, we can see this is a memo from you to the chair and to Mr. Taylor, 7th of November 2000, enclosing a response from Paisner, so from a firm of solicitors whom the Society had asked for advice, responding to queries about the Hcv campaign. And then you say that the campaign may continue perfectly lawfully. And then you say this brings us back again to the central questions raised by me and others many times previously. How much resources is the Society prepared to commit to this campaign and for how long? What else would the trustees drop in favour of funding the campaign? Now, before I just ask you a couple of questions relating to the letter from the solicitors and the advice contained within it, can I just ask about your views? You appear to be in the second paragraph recording that you had on many times raised the question about the Society committing resources to this campaign and how long the campaign should go on for. What were your concerns as Chief Executive?
My concerns would be that the charity, the Hemophilia Society, has a remit which is to do with providing support and services for people affected by haemophilia. It has an advocacy role, but it also has a service provision role. It was a small charity with limited resources. It was also during this time becoming aware that there were needs that had not yet been met. For instance, identifying that von Willebrand's disorder was a very widespread bleeding disorder and it affected women. So the issue really for the charity with limited resources and a remit that is much broader than advocacy and campaigning was that very difficult question of where to put the balance of priorities and where to spend the resources. And so the question is, I think, legitimately posed. If the campaign were to continue to be prioritised and resourced to the level that it was, or possibly more in terms of funding, time and effort, then potentially with limited resources, committing more to the campaign might involve committing less funding, for example, to service provision. The pot is only so big of resources that the charity had available. And from my point of view, as CEO, I think I was doing my duty, as it were, in reminding trustees that there is a broad remit for the charity. There's a huge need for service provision, for support of the kind that we provided to the membership. But there are difficult choices here about how the money is spent, how the resources is spent. So that's really where I was coming from as a, I think, responsible CEO in asking the trustees to consider this question because it would not be possible to meet all of the needs for service provision and all of the demand perhaps for campaigning out of limited resources.
If we just go to the Paisner's letter, if we go to the next page, please, Shomik. So we can see it's a letter addressed to you dated the 2nd of November 2000. If we go to the next page, we can see halfway down the letter, the page is a heading "Concerns about the campaign," and it refers to Mr. Taylor's concerns, and we can see those in italics. So legality of the campaign, not going to ask you anything more about that, and we see the advice given was that it does fall within the Society's objects. Legality of members of the Society seeking financial compensation, and again, I'm not going to ask you about that because reassurance is given by the solicitors in that regard. But if we go over the page, we'll see that the third concern voiced by Mr. Taylor was about the likelihood of the campaign being successful and the factors which the trustees must consider. And it records Mr. Taylor's view. He does not believe the Society will obtain the reversal of government policy, which is, of course, a refusal to hold a full public inquiry and to compensate haemophiliacs who've been infected with hepatitis C through contaminated blood products. The basis for Mr. Taylor's views are then set out, and then there is legal advice about the way in which the trustees should take a decision on these matters. The question for you, Ms. Pappenheim, is did you share Mr. Taylor's doubts about the prospects of success of the campaign? And was it your view at this point in time that the time had come to draw an end to it?
I think it's very difficult to put myself now, at such a distance of time, back into what I might have thought, believed and felt at the time. So I think it's very difficult to try and explain today, in this time, what I might have thought and felt back then. I think the comment I would make is that there was a great deal of debate on the question, given what we've been talking about how much effort, how much money, and we've already talked about all the techniques that the Society was deploying. I mean, we were doing a very intensive campaign of action involving all of the political activity that's already been spoken about. We still hadn't achieved success, so it would be perhaps unrealistic not to have asked that question. We've done so much, we've tried so hard, what else can we do? And it would be a little bit unrealistic not to ask the question, do we actually think we can be successful? You have to live in the real world, and obviously Simon Taylor had his view, and it's absolutely correct and right that an individual trustee should be able to express his view as a trustee. And I wouldn't speak for Simon, I know he'd be a witness for the inquiry himself, but he had that very strong view, and obviously it would be important that that view as a trustee would be heard. But I guess really not to have asked some questions about whether success could be achieved, given where we were at the time, it would seem surprising if at least there wasn't some questioning of, will we ever succeed on this?
So I note the time. Perhaps we could take a break for lunch at this point.
Yes, well, let's do that until 2:05.
Thank you.
So 2:05.